Welcome. I'm Felice Orlick, and I'm one of the psychologists at the Autism Center and also faculty in the School of Medicine. And this is Rachel Earle. She's one of our postdoctoral fellows. So today, before we start speaking, I wanted to give some disclosure. I know there are folks on Facebook. Are there folks elsewhere listening? And folks online, so hi to everybody. I wanted to give some disclosure about who I am because I'm talking about a topic for a population that I'm not, because I'm going to be talking about gender diverse youth with autism, and I myself am not a gender diverse person with autism. I have a child with autism, and I have a child who's gender fluid, but I'm not either of those people. So I want to be really clear about that because and Rachel can talk about herself, because we're going to talk about people's experiences with being both on the autism spectrum and also gender diverse. And I want to make sure that I say that because I can't speak directly to their experience. So just wanted to be clear about that. The goal for today is to first orient you to the terminology. The second is we're going to talk about the prevalence of what is called gender variance or gender diversity in autism and how there is a higher co-occurrence. We're also going to talk about how we typically assess gender dysphoria. Rachel's going to talk about that, and how we should assess gender dysphoria in autism, because they're two very different things and very different populations of kids. I want to talk about affirmative therapies, taking into account how we look ahead for kids and for families and how we see it as a collaborative approach to have some forward movement for all. That can go in many directions. It doesn't have to go always towards the direction of medical therapy. It may go in different directions, but our point is to really meet parents and kids on the path of where they're going with that. And then we also want to talk about how the gender clinic at the Autism Center runs, so people know how we work and how we work together with the gender clinic over here at Seattle Children's. Sound like a good plan for the day? Alrighty, excellent. What we'd like to suggest, because we have a lot of information to cover, is that we leave questions for the end. Otherwise, we'll never get done with the talk, as the students from my class know. So the spectrum for gender, and this picture covers not only gender as a spectrum, but also sexuality as a spectrum. And what I can tell you is that this is a really small proportion of the different words that we have for people's gender identity expression as well as their sexual preference expression, right? It's a very fluid and dynamic use of words. And I can tell you that I think every other week at least I learn a new word from the kids who come in to talk about their gender, their sexuality, or just having autism. I have been educated by them. Thinking about background terms, we think about, for kids and for us as well, that we have our biological sex. That pretty much is defined. I'll come back to this a little bit later. It's pretty much defined by what our body looks like, and also our reproductive organs as well. That's what your biological sex is. Sometimes, for some people, your biological sex, or what we would also call your assumed sex at birth, doesn't equal their gender identity, and that's for some people. So, your biological sex is also called your gender assumed at birth, and that's an affirmative kind of way of talking about people's gender or biological sex at birth. Or another terminology would be your gender assigned at birth. If you get reports from us, or when you hear us speaking, we'll talk about gender assumed at birth. And that can differ from someone's gender identity. And that's what you identify your gender as. So, my biological sex is female. My gender identity is female. And I use the pronouns she and her. For example, if my biological sex was female, but my gender identity was male, then I would be a trans male, for example. But I wouldn't, my gender, my biological or my assumed gender at birth would be female. So when we're thinking about how kids and also adults have what we call gender dysphoria, that usually arises from a person's gender expression, which is not their gender identity, and that's really important in autism, is that a person's gender expression, that's how you look or appear, and as well your gender expression is also about the hormones you have in your body, do not match your gender identity, your sense of who you are, then what you might experience is gender dysphoria. Now, you don't need to have these two in misalignment to experience gender dysphoria. One of the goals, though, of therapies that help kids with other people using kind of the pronouns that they want, that get to dress in alignment with their affirmed gender, is our goal is really to decrease gender dysphoria, right? I think that's really the goal for us in all of the therapies and interventions that we try to move forward for kids and families, at least from a mental health perspective. So just to go over this again, because the terminology can get really confusing. Cisgender, right, is where your gender identification is the same as your biological sex or your assumed sex at birth. A transgender male, right, identifies as being male but is an assumed female or biological female at birth. A transgender female, right, has a female identity. Remember, identity is the thing that you identify as, but is assumed male at birth. Everyone got this so far? Gender non-binary is where your gender identity is neither male or female. And living with one of these kids, it can shift day to day. Like, I don't know who it is in the morning, but so I ask. I think I need a sign on my daughter's door or something. All right, your affirmed gender is the expression of one's gender identification, right? That's how you express it. And our goal, like in our therapies with kids and in our approach, is to be affirming. Yeah?
It says cisgender?
Yes.
I missed that. What is CIS?
Cis, I'm actually not sure why we say cis. Does anyone know? I'm not sure why the word cisgender. Yes?
I can't remember the background, but it means same as.
Same as. So your gender identity is thank you, same as your biological sex. That makes sense. Thank you. I can't believe I did not know that. Now I will know for next time. All right, so the gender and your affirmed gender is how you express your gender identification. When you meet kids on the autism spectrum and their gender identification is not their assumed gender at birth, you can't assume that their gender expression, right, how they look, actually is how they feel. Kids with autism present really differently with gender dysphoria. And we'll talk about that a little bit more later in the talk, but it's one of the challenges in terms of assessment for us and in terms of therapies, really more in terms of assessment. Gender diversity is where kids have non-conforming gender experiences, right, or identities or expressions. It's kind of like our autism spectrum disorder label. Okay. All right. I don't think that was me. There. Maybe it was. Okay. All right. So this is something that we think really works well for younger kids especially, but I think it's pretty instructive because it kind of breaks things down a little bit more easily. This is our gingerbread man, or gingerbread person, rather. And One of the ways we think about the construct of biological sex is that biological sex refers to objectively measurable organs. So if you're female, that means you have a vagina, for example, and ovaries. If you're male, over here on this part, then you'll have a penis, for example, and testes, and XY chromosomes. And there are some kids who are intersex who have a mixture of chromosomes and also a combination of different reproductive organ systems. Gender identity is separate from biological sex, as we talked about. And there can be people who identify as women, people who identify as men, or people who identify as genderqueer. That's another terminology that you might hear, especially from your teenagers who are gender diverse or gender fluid. Gender expression is another kind of, I think of these as multiple axes for kids. Gender expression can go from feminine to masculine with androgynous in the middle. Now, we live in Seattle, right? So Seattle is a very androgynous culture in general. So it's been very interesting for parents who come in and say, oh, my child isn't dressing in a stereotypically male or female way, but our culture in Seattle is androgynous largely. Like if you're a guy or if you're a girl, your dress is not dissimilar, and we're really into black, right? So the other axis here is sexual orientation, which is truly separate from gender identification in typically developing kids. It's interesting because there's some emerging kind of research on kids with ASD where we're starting to think that there may be more of a relationship between gender identity and sexual identity or sexual orientation, but that's really preliminary thinking. Sexual orientation also goes from heterosexual, where you prefer someone of the opposite sex based on your gender identity, so that's important. Homosexual, where you prefer someone of the same sex as your identified gender, or bisexual, where you don't really have a choice, a preference. Well, you may have a preference, but you are attracted to both men and women. And then if you're pansexual, which is not on here, it means you don't really have a preference either way. So bisexual denotes more of a preference for the kids. Okay, so do you guys have any questions so far? Am I having trouble with this? Oh, no. Okay, thank you. Thanks. So let's talk a little bit about autism and how autism overlaps with gender identity. So among people with autism, let's think about the base rate of autism spectrum disorders in the general population. About 1 to 2% of people in the general population have a diagnosis of autism spectrum disorder based on the latest kind of CDC estimates, for example. In the general population, about, I'm trying to think of the percentage, I think it's about 2% of kids identify with gender as gender diverse, and that number is a little bit fuzzy, actually, because it kind of ranges from 2 to 23%, depending on the study. What we see when we look at kids with gender dysphoria more globally, we see that there is about a 7% on average prevalence of autism in that population of kids. So that's really different from the base rate of autism in the general population, right? So how we think of that is that among kids with gender dysphoria, there's an overrepresentation of autism, okay? And that's of a known autism diagnosis, because what we also see is that there's a higher kind of prevalence or characteristic of autism-related symptoms in people who present to gender clinics as well. So this is an interesting finding for us, and it's something of interest, of course, because that's how we actually got involved from the autism clinic, because there were so many kids presenting to the gender clinic here at Children's with possible autism spectrum disorder. So just as autism is a really, and I'm assuming you folks know about autism. I know you guys do. Just like autism is a heterogeneous, a really different presentation no matter who you see with autism, gender identity in people with autism is also very heterogeneous. Okay? It's a really variable kind of presentation. So looking at, just in a survey, comparing people, right, typically developing people, people without known autism, for example, to people with autism, and this is self-reported, so I want to, say that about this study. It's a self-report kind of study, which is not always as tight as we would like it to be. They were trying to compare the rate of autism, self-report of autism among this population, and also the rate of autism kind of characteristics as well. They were trying to go at two things here. And essentially, the bottom line of this study was that people with autism spectrum disorders reported a greater diversity of gender identity, okay, with more gender dysphoria. So more of that feeling of discomfort with their gender traits than typically developing counterparts. So that's an interesting finding and I would say that qualitatively, just working in the clinic, that kids with autism are more flexible, right? Both about their sexual identity as well as their gender identity. They're a more fluid group overall, right? So I don't see this from my perspective as something pathological, right? I do feel that it's in alignment with the way that teens with autism present. It's one of the things I appreciate about teens with autism. So rather than seeing this as a form of pathology, I see this as a form of flexibility and maybe not caring about social norms as much. Okay. And just to look at what some of the theories that people have suggested, and these are truly just theoretical, right? I would say that the newer theories are perhaps better than the older theories of why people with autism may show a higher prevalence of gender dysphoria and gender diversity. Previously, the thinking was that perhaps people on the spectrum were hyper-focusing on gender, right? And that having gender diverse traits or being gender diverse or thinking you were transgender was really a form of perseverative thinking. And that's largely not what we think any longer. That would be not something I think we've ever seen actually in clinic, and we've seen quite a few kids. Where we'll probably land is that gender diversity and autism or gender dysphoria are truly co-occurring disorders. I think eventually we might get to that. We're not there at all, with some possible complex overlapping biological and hormonal mechanisms. That's probably, especially autism, we're driven a lot by our biological theories, so that's probably where we'll end up. The other part of it is that there may be true theory of mind differences. It's interesting, in the most recent conference, the big autism conference that occurred a couple of weeks ago, there was a lot of discussion about how we're often trying to have people with autism fit into the molds that we have for what's socially acceptable or appropriate. And I think that as a parent of a child with autism, and I know there are parents here as well, there's a real value in understanding that the way people with autism think is also unique and an important contribution to who we are as a society, right? It's not something, there are many like strengths to it that other people don't have, right? There are superpowers to it as well. And I think part of that is that I think the kids often just aren't moved as much by societal norms, and they're better able to explore their kind of the diversity in life in general. I think that qualitatively we find the kids to be less judgmental overall. And I think that is why, one of the reasons we're probably seeing these kids more likely to come out. I also see that parents of kids with autism have been in the trenches with their kids since they were younger. And having a child who is gender diverse or questioning their gender or sexuality is another thing that comes across your plate to deal with. So, and I think because of that, I feel like for us, on the autism side, in general, parents are good seekers of information. And I think that is really helpful for our population here. That's not necessarily the case that we hear from older people in this population, but for our population largely, this is a pretty educated and forward-thinking group of parents. So I think there are two good sides to it. There's some suggestion, although this is something we really bounce around with quite a bit in our clinic, is that gender variance can also be related to a reaction to sexuality. And that hypothesis I'm not clearly sure about, because they're probably overlapping for people with autism spectrum disorder. And most of this comes about because many kids on the autism spectrum identify as gender diverse after puberty. It's a later occurring identification. And I think because of that, if you're back chaining your thinking, you would say, well, that could be related to sexuality. Like I said before, there probably is some relationship between a person with autism's gender identity and their sexuality. Perhaps when you figure out your gender identity, sexuality comes online afterwards. Might be a good way of thinking about it. That's not unusual as well with neurotypical kids. It's kind of a similar pathway. And the other thing is that we also see a similar set of social challenges in kids with gender dysphoria who don't have autism. So we see many of the same characteristics. And the hypothesis there is that that's really almost like an environmental form of autism symptoms. That because kids who are transgender or gender fluid within their social environments are socially quite isolated and maybe self-isolating when they're younger as well, their social experience isn't as well developed, and we'll also see some of the pragmatic challenges that we see in youth with ASD. So just to talk about some of the data, some of the specific data. Like I said before, there's higher rates of gender variance in autism, and girls with autism and women with autism are more varied in their gender identities. So I would say in our clinic, that definitely bears out, that it's more frequent that we meet trans females on the autism spectrum, and for biological females, we'll see more gender diversity, both trans males as well as gender diverse kids. There's a broader range. So that really plays out in clinic as well, which is interesting. They also found in this study that there was lower rates overall of people with autism having a strong gender identification to start with. And that bears out a little bit in our experience with how kids with ASD, we have a study now, qualitative study, looking at when do kids with autism really start to think about gender? Like, when does it really come onto their radar? And it's kind of a late developing identification for them. So what we see is there's less kind of good feelings about gender in kids with ASD about like, wow, I'm a girl, that's so cool, like girl power. Or like, wow, I'm a jock, that's so cool on the male side, just to be really stereotypical here. So we see less of that than in typically developing kids who they're matched to. Okay, I'm not going to lose my voice. The other thing that we think about is how much social anxiety actually fits into the puzzle, and that there's on the representation of autism-like traits in people with gender dysphoria. we'll see a higher rate of social anxiety among those folks who also seem to have characteristics of autism. The other thing that fits with the idea that people with autism really don't care about societal norms like the rest of us is that we see an elevated prevalence of also same-sex attraction. So, which is interesting, that the more quirky you are, the more flexible you are. It's kind of an interesting idea. Oops, sorry. Kind of wanted to go back to that. And some of the themes that have come up for youth with autism spectrum disorders is that some will recall early gender nonconformity, but as you would imagine, that's kind of challenging in kids with autism who don't play with toys typically to start with, right? If you think about that, that's a really tough one to talk about. And who dresses kids with autism when they're little? We do. And they also have sensory sensitivities, limits what you're going to wear, for example. Kids will talk a little bit about gender dysphoria, especially as they reach puberty. And one thing that we've had kids talk about quite a bit is just kind of this interplay of gender identity and also having autism, and how to grapple with that, and how to fit yourself into the groups at school that might provide support. That's kind of a mixed bag for kids with ASD. Okay, some of the research, oops, did I just skip ahead? I did. Did I do that? I don't know what I did. All right, there, that's better. I just want to tell you a little bit about the research here because our prevalence data is a little bit higher, which is kind of interesting for us. And that may have to do with us being in Seattle as well, but I'm not sure. Maybe it's just who we're pulling for. So one of the things we looked at in our clinic sample here coming through the gender clinic is what is the overlap of gender dysphoria with what we call ASD risk? Because when kids are coming through that clinic, right, we're assessing whether or not they have any, we screen them for autism spectrum disorder risk, and also to look at any co-occurring challenges. So in the last, and this is data from the first 2 years, the gender clinic has been open here at Seattle Children's for about 3 years. So this is the first 2 years of data. So in those first 2 years, there were 113 unique patients. That's a lot of patients anyway for the first 2 years. And of those kids, 20% of the patients were identified as having high-risk autism spectrum disorder. So of that cohort, 20% were picked up as having characteristics of autism, and then were sent over to our clinic for diagnosis, while only 8% carried a known diagnosis of autism spectrum disorder. What that means, and Rachel will talk about this as well later, is that in this clinical group of kids, it needs to be on our radar, even if they don't have a diagnosis of autism, that we need to be thinking about it, right? It needs to be something we need to address. Because one of the things that we're thinking about, especially when the kids come to us, is it's not just about the hormones, it's not just about the social transition, it's about thinking of every child and teenager as a whole person who has to negotiate life, right? And on that path to being a whole person and to have a healthy transition, we need to know all the things that we need to have in place to really support that person. Okay, that's really where we're coming from. And that's why knowing the co-occurring diagnosis of ASD is so important. The things that we also see in kids, which fits, if you think about some of the earlier data on autism, people with autism and those characteristics and how they feel about their gender and their self-esteem around their gender, is that we see a higher prevalence of anxiety and depression in this group, as well as ADHD. Rachel and I have had some really interesting experiences this past year with the kids that we have been seeing who have the dual kind of presentation of gender diverse, right, either gender fluid or transgender, as well as autism spectrum disorder. And we are seeing a somewhat high prevalence of ADHD, but mostly the inattentive type. So we are feeling that that's actually an important area for us to address as part of our assessment because we see that as something that should be treated, right? And rather see that as something separate. So it's just one of the kinds of pieces of the puzzle we think it's important to look at. The other thing, which is something that is quite prevalent for kids neurotypical and kids with ASD who are gender diverse, is that there was also an elevated rate of self-harm and suicidal ideation. So the upshot from our data is that first, we may be under-identifying kids with autism in our population of kids who are gender diverse, and as well, that population, both kids who show some of the characteristics and kids with ASD are at higher risk. So it's up to us to help them build coping strategies. Okay. The other piece of our research, which is newer, what did I do there? Yeah, okay. The other piece of our research, which is our qualitative study, is really geared at what Rachel is going to talk about more, which is how we actually do assessments for this group of kids. And what we're trying to understand better is how kids with gender dysphoria, with autism, and with autism, actually think about gender and their gender identity. And this really surrounds how assessments of gender readiness or readiness for gender-affirming treatments, for example, like hormones or pubertal blockers, are completed. One of the biggest pieces of the interview and assessment for that kind of, for readiness assessments centers around early childhood and whether or not a child identified as their born gender, their biological sex, when they were younger or not, if they played with gendered toys, for example, how they dressed and who they were friends with. So for kids with ASD, those might not be the most relevant questions. The other thing that we were hearing from kids in our clinic was that gender wasn't even on the radar until a lot of our kids hit puberty. They didn't even think about it, but puberty makes it pretty obvious to a kiddo with ASD, who might be, think about things a little bit more concretely. The other thing, and that data, we don't have the results of all of that part of the study yet. We also looked at kids with autism's perceptions of school climate, okay? Because what we do hear from a lot of our kids, unless they're going to Nova or one of the schools that are really more open kind of schools, not open necessarily open progressive, but just a different kind of environments in schools, is that the kids weren't really accessing the usual kind of supports that we'll see neurotypical kids access, and that would be LGBTQ support groups, GSAs, all of the things that we know are very important to outcome in neurotypical, transgender, and gender diverse kids, and LGBTQ kids in general, more generally. And what we found, what we're starting some of our emerging themes from that study, is that the important things for kids with ASD who are gender diverse to feel safe are really driven by how teachers approach gender diversity and also sexuality. And that inclusive anti-bullying programs are really important. Having access to the bathroom you need is really important. And one of the things that one of the kids said was really striking, where they said, I don't want my teachers to go on a rant or wave a pride flag. That was really good. I just want them to neutrally say, knock it off in class, right? So the idea was not to really go all out, because, kids with autism, most don't want you to go all out, right? They want you to neutrally handle the situation in a fair manner. And that's really what came out of what the kids had to say. All right, so I am going to turn it over to Rachel.
All right, can everyone hear me okay, where I'm at? Okay, great. Excellent. All right, so we are going to shift gears and talk a bit more about really what it looks like to think about assessment and intervention for individuals who are both gender diverse and on the autism spectrum. I'm going to talk about these kind of overall goals more broadly, and then we're going to go into what really is unique when we're working with a population that exists on two spectrums. So we're going to talk about that. So, as Felice mentioned, this current research really highlights that we need to be thinking about gender diversity in individuals with autism and vice versa. We need to be considering all of these approaches and thinking about how we really create affirming care, both medical care and mental health care. And so, in thinking about our assessment approach, a diagnosis of autism does not exclude gender-affirming medical interventions. And a lot of our work is to provide really consider the different factors and consider how to really provide a holistic approach to care. One of the primary aims of assessment is kind of traditionally referred to as a readiness assessment or readiness evaluation, with the idea being traditionally that it's readiness to begin some sort of medical intervention as part of a physical transition. And over time, providers have kind of moved away from this idea of this term readiness, just because it alludes to us as gatekeepers to intervention, gatekeepers to support. And we really don't feel like that's the healthiest or most affirming way to think about it. We really want to partner with patients and their families. We want to partner with them and really just support them along their journey to understanding themselves and to really living into their affirmed gender, however they wish to do that. So as part of our assessment, I'm going to be using that term readiness because that is the traditional term. But I want to highlight that that when we talk about this, we're really wanting to partner with families, not serve as a gatekeeper that's holding the keys kind of to moving forward. Some of the considerations that we think about that I'll go into a lot more detail when thinking about individuals who are on the autism spectrum and identify as gender diverse is we want to think about supports that are also really enhancing access to social skills supports, access to psychoeducation around sexuality and development. Particularly, as Felice was mentioning, you have a really not as much awareness of gender roles, of emerging kind of gender dynamics until puberty, and so there's really kind of key aspects that we want to make sure that we're really providing access to information and supporting that aspects of development as a whole as individuals are reaching puberty. And then kind of overarching, we really think that there needs to be evaluations thinking about potential gender dysphoria in screening for autism and vice versa. The study that Dr. Orlick mentioned previously really highlights that potentially there's individuals being under-identified in both groups. All right, so in thinking about overarching assessment goals, and these are assessment goals that really apply more to gender diverse individuals as a whole, and then I'm going to go into what are some of the unique considerations we think about when we think about autism as well. But assessment goals vary depending on a child's age, and generally prior to a child reaching the age of puberty, assessment goals are going to look different, and they're going to really focus more on aspects of social transition. So really partnering with children and their families to decide how social transition is going to happen. What does the child feel comfortable with? How do we support parents? How do we offer support and skills to help navigate and advocate for their children? As well as to balance all the perspectives that are swirling around as families are trying to navigate these different pieces. A lot of that comes down to supporting transition within school and how to support families as they're advocating for their children in the schools. And so our assessment goals are really looking more to some of those more environmental supports and then providing that psychoeducation to help families understand their child's development and understanding their child's emerging identity. Oh, and then I should note that as a child approaches puberty, it's really not until then that conversations around medical interventions come into play, and this is where we start to think about hormone therapy or puberty blockers. but it's really not until kids reach that age, which varies depending on the individual. So it's really a dynamic process in working with the family to partner with them to decide how that conversation goes. And then as teens get older, as they hit puberty, then we start to really have more discussions around consultation and treatment. And again, that's medical treatment, but that's also thinking about mental health supports and how we can provide holistic treatment and holistic care and support. And then we begin to think about possible readiness evaluations or a referral for cross-gender hormones. There's a series of guidelines that providers are looking at to try to understand this concept of readiness and the concept of just appropriateness of these cross-gender hormones. I want to note though that each person is viewed individually, and so you're going to see some kind of specific criteria, but it's far more than like a checklist. It's really taking in an individual's unique experience and unique qualities and characteristics to factor in this concept of moving forward with hormones. And so some of these include things like being 16 years of age, but there are definitely individuals that are younger when starting medical treatment. That's kind of just the average age where hormone treatment can be started. Generally, providers are looking to see that social transition has happened with at least 6 months, and that the patients have had the opportunity to live into their affirmed gender role and really kind of explore aspects of that. We also really look to see whether there's ongoing access and treatment to a mental health provider. And if there's not, that's a lot of what we do working with families is helping them find a provider that is really going to serve them holistically, again, serving both their exploration of gender identity, but also some of the co-occurring anxiety and depression and things that can come up in navigating this challenging journey. We also look for a diagnosis of gender dysphoria, which, as Felice was talking about, is this incongruence between assigned gender at birth and affirmed gender identity, and distress around that incongruence. We also look for things that indicates stability of functioning, and that can look like a variety of different ways, but we're really looking just to see in terms of, school and social activities and work and emerging independence and all these pieces to really just make sure that we're evaluating a person holistically. Evidence of coping skills, following of current medical recommendations, as well as assessing safety. And that's something that we really do approach delicately, and particularly given the fact that depression and anxiety are often high in prevalence in individuals who are gender diverse. We want to consider that we're thinking about safety as well, and we're thinking about coping skills and strategies and supports in place to help support individuals that might be struggling in their mental health. So some of the unique assessment considerations that we think about for individuals that, again, are on both spectrums is the ability to kind of articulate clear gender identity differences. When we're evaluating gender dysphoria, that is something that we're looking for, the ability to kind of come up with this clear articulation of what is different about someone's affirmed gender identity versus their gender assigned at birth. And what's challenging is that for individuals with autism, there's social communication challenges that can get in the way of clearly articulating that difference. We need to consider intellectual and communication impairments that might adjust how we're getting that information and how it's being communicated. And so often when we're working with patients, we're finding alternative ways to communicate with our patients and to understand their perspective and understand their gender identity. And it may not look as straightforward as assessing gender dysphoria in individuals that aren't on the spectrum. Another aspect of gender dysphoria is this idea of gender identity dissonance occurring very early on. And as Felice mentioned already, often we find that individuals on the spectrum haven't thought a lot about gender until they hit puberty. And so we're finding that in going back and asking these early developmental questions, that picture just might look a little different for individuals on the spectrum. Some patients are very clearly able to articulate that disconnect for them early on, whereas others it just was not, because it wasn't on their radar, there isn't that clear, clear experience until a little bit later on. Other things we think about is, along with this early childhood trajectory, is a lot of the questions we ask about are, to assess gender dysphoria, are thinking about preference for what kind of toys did you prefer when you were younger, who did you gravitate toward when you were playing, what did you wear, these things that are really going to look different for someone on the spectrum than someone who's not on the spectrum. Thinking about early childhood toy preferences, again, that could look very different. Also, individuals that have early social communication challenges have differences in their relationships with other kids. So how they're interacting and who they're gravitating toward is potentially going to look different and unique. And so we want to take that into consideration and really understand gender dysphoria in that unique context. We also want to consider comorbidities, ADHD, anxiety, these different symptoms that we've already mentioned as being often prevalent in this population and that can really impact clinical presentation. So we, again, back to this, Phil, we keep mentioning this holistic model, but really trying to understand and partner with families so that we're getting a full picture of a patient. So we're going to be talking about our approach to assessment, particularly of how we think about it at the Autism Center Gender Clinic. And we really consider it to be a continuum or a pathway approach. And we find this to be really important because we're a multidisciplinary team, and our entire goal is to support families and to lessen the level of distress that comes up with gender dysphoria. And really, this means first and foremost supporting that sense of movement for a child in moving toward their affirmed gender identity, but also balancing that children exist in a family and balancing all those parent and child perspectives and plans and really helping to partner and try to support families in that journey. And the reason we use the term pathway is it looks vastly different depending on the child. So for some families, coming in and engaging in an initial assessment is the forward motion. And they might kind of hit what we refer to as maybe an intermediate position where we're not moving, there's no active effort to move forward, particularly with physical transition or social transition. For some individuals and their families, that first step is then kind of where they stay for a while. The length of time may vastly vary before action is taken in different steps. Again, whether that be social transition or a physical transition and a seeking of medical intervention. But as families decide they want to move forward, as patients decide that that's where they want to go, we really work tightly with a family to encourage social transition to affirmed gender role and identity. We want to be affirming in a patient's affirmed gender identity. We also want to foster support and education for families and the child. We want to really kind of take a multi-system approach so that this child, as they're transitioning, whether socially or physically or both, how can we make sure that their community is supporting them, that at school and at home there's partnership happening. We also want to address co-occurring issues and challenges when we think about our pathway approach. Again, the various challenges that occur are going to influence what that pathway looks like. And so we're looking at, unique factors related to those pieces. And then thinking about, that kind of forward motion, that sense of movement, we want to develop steps toward gender-affirming interventions and find a way that works. And the reason I think pathway is a really important way to think about it is that it's unique for each person and it's bi-directional. It's not something that once you're moving forward, that's absolutely where you need to go. We want to partner with families and partner with our patients so that regardless of where they go, if they want to move forward on the pathway, if they want to stop and stay there for a little while, they want to move back, that's completely within their gender identity journey, and we want to support that and support kind of where the family is at in that given moment. So in thinking about some of the challenges that come up for individuals that are gender diverse and their families, we're gonna kind of just, these are a wide variety of issues that really look different depending on the child or teen, but they also are commonly recurring challenges that families are facing. And so kind of part of the pieces of even timing of transition. It varies amongst individuals, it varies socially or physically, and how to navigate both of those. For individuals on the spectrum, something that we've noticed is that there are some individuals that really don't feel comfortable socially transitioning until there's been some sort of physical transition. And so that's something we also want to respect and acknowledge and kind of help them navigate. Issues related to school are huge. That's just so much of what we see for families and for patients trying to navigate social transition and then eventual physical transition if they seek that out. School related to bathrooms, to how staff are responding, to how staff are responding to reactions and hurtful comments from other kids, bullying, teasing. All these different pieces are really at the forefront of patients' concerns and their parents too as they're navigating this. Reactions of family come into play, the impact on parents, potential experience of loss and a shift, and how parents have perceived or kind of planned for what their child would look like or what that identity would look like. Impact on siblings, ideas around romantic relationships. We also think about the social stigma of not clearly fitting into a gender dichotomy, that male or female gender dichotomy, and the bullying and teasing that can occur from that, right? And I think when you add in the additional piece of also being on the spectrum and there being social challenges there or difficulty feeling understood amongst your peers, you then add that other piece about the gender dichotomy and really not feeling you fit in. There can be a lot of social isolation that occurs there. And we want to think about the challenges of dealing with systems. And this relates to both medical systems, mental health care systems, school systems. Families are navigating a lot of systems of care to support their child through this process. Issues at school we've kind of touched on a little bit, but really this kind of idea of when to tell, who do you tell, how that works. Sometimes our children and teens have different ideas than their parents do about when to tell and how to disclose in those pieces. And so we want to have a conversation and discussion and really find a solution that works for everyone and really affirms the patient. Orchestrating gender diversity training for school. Parents often have to be really strong advocates for their children, and I feel like so many of the families we work with whose children are on the spectrum, they're really used to being advocates. That is they are just, it's what they've been doing since day one. And so there's a level of advocacy and really having to do a lot of education, which is so important and yet is also really hard and difficult to navigate. It's emotionally has a lot of weight to it. Transferring to a new school can come up, gym class, bathrooms, all these things that come up to be really challenging. Pronoun use, whether that's established within school where really there's a kind of a direct communication of pronoun preference, and then how that's followed. If some teachers follow it and some don't, or peers follow it or don't, and then bullying and harassment that can occur. So issues at school are something that we target a lot when we think about intervention and treatment and where we think about research going forward to really provide more supportive, affirming care. So again, some of these unique barriers that can come up for individuals that are on the autism spectrum who are also gender diverse is there's limited community mental health providers that feel A, confident to support an individual on the spectrum, B, that are comfortable supporting someone who is gender diverse. And when you combine those two elements, it can be often hard to find providers in the community that really feel comfortable providing service, feel like they are equipped to provide services. And so something that we think and talk a lot about is how do we help support community providers? How do we provide psychoeducation? How do we really equip people to have more experience in that way, so that we can start to increase access to community providers? So this can delay or dismiss the diagnosis or treatment. It can be something that is dismissed because there's already an established diagnosis of autism, or dismissed because there's already an established diagnosis of gender dysphoria. So vice versa, we can find that there's kind of an under-identification in the community for various reasons. We do provide gender-informed mental health care at the Autism Center, and that is really something we are committed to and want to support, as well as to really increase. We know that there's the need is greater than the number of providers we have, so we really want to support community providers to equip them to also be providing that kind of care. And then coming back to this idea of a unique pathway for someone on the autism spectrum who's also gender diverse, is that families are often faced with consulting with multiple specialists. And so often families kind of get ping-ponged across the medical system. They spend some time consulting about medical intervention, and then they're maybe sent to us to also provide that kind of more readiness evaluation. And then there's periods of waiting, and there's wait lists for every provider. It's a really challenging and taxing experience for families. And so part of, as we're thinking about how to support families in that, we really want to help provide kind of a hub for interdisciplinary care, that we can collaborate with the Seattle Children's Gender Clinic at main campus and provide more of a hub so that we can see more families and that we can really equip the community to serve this population as well, so that families aren't staying on wait lists for too long. We also want to think and consider about this gender identity transition and what that might look like to socially transition. And I alluded to this earlier, but some of the theories around some of the cognitive rigidity that comes along with being on the spectrum is that could potentially play into why some individuals don't necessarily feel comfortable to socially transition until they've started hormones, because there's a clear kind of cognitive component that just feels like a disconnect. And if the hormones are in place and there's a real kind of biological shift, then that social transition feels more comfortable. And this isn't for every patient, but we notice this is something that occurs for individuals that are on the spectrum, and so we want to consider how do we help support patients to get what they need so that they feel comfortable. They feel comfortable in their own skin. They feel comfortable moving forward to their affirmed gender identity. So now I want to talk specifically about our gender clinic at the Autism Center. We started seeing patients, or Felice started seeing patients in 2016, and it's become a really thriving interdisciplinary training clinic, which is really exciting. We've seen 46 individuals who have completed full assessments in this time, which is exciting to us and makes us really excited for the forward momentum of serving individuals that are on the spectrum and who are gender diverse. Referrals have been primarily through the gender clinic at main campus, and then increasing internal referrals, so individuals that already have a diagnosis of autism and are seeing a provider at the Autism Center, and parents are noting that there are questions around gender, or they're wondering about potential gender identity differences, and so providers might be also referring in-house as well. Our clinic has become a hub for research and for really understanding our patients, understanding unique aspects of gender identity, understanding how we can better serve individuals that are coming through our clinic. And as I mentioned before, I am a trainee within this clinic, and it's been a really rich experience to have as a training experience as well. So I think this clinic is really multifaceted in our ability to serve youth with autism and who are gender diverse as well. So some of the overall services that are included within our clinic, and as well as kind of the Autism Center as a whole, is we think about the psychological evaluation. So this is where we think about this. Well, sometimes it can look like a readiness evaluation or kind of providing that mental health evaluation, but often we see that there's kind of one of two types of evaluations we end up doing. So some individuals that have already been seen at main campus about possibility of pursuing medical intervention. Either they have had prior concerns or there's questions of autism that are raised. And so they may come back to us and then have an evaluation to actually determine whether autism is an appropriate diagnosis. So they already have a diagnosis of gender dysphoria, and we're confirming that and then also answering that autism piece. Or someone that already has a diagnosis of autism and has potential concerns around gender dysphoria, we would then also support there. And because of our attention for comorbidities and for elevated prevalence of ADHD and anxiety, we're really doing a comprehensive assessment so we can really understand all the different factors that may be at play. All of that leads to recommendations for treatment. So how do we support families where they're at? How do we help align them with resources? And how do we help them kind of partner with them as they think about what their next steps are going to be? So depending on a child's age, we would then begin to think about screening for mental health readiness related to puberty blockers or related to hormone treatment as an individual gets older. And In addition, we're also providing treatment to support social transition and readiness for hormone treatment. So this can look like a variety of different things, but within a mental health therapy context, some of the things we might think about are if a teen is really wanting to move forward with hormone therapy, but has a pretty significant needle phobia. That's something that we want to make sure we're addressing in therapy so we can help that patient overcome the anxiety that might come with the medical treatment that they really want to receive. It can also look more broad where we're addressing issues related to depression and anxiety, things that are influencing quality of life, influencing stability of coping skills and distress tolerance, so that we're really kind of trying to provide that mental health support as well to navigating what is a complicated process, as well as navigating these different components that could be kind of impacting kind of movement forward. So in addition to what patients that are seen through our gender clinic, a large number of our providers are also providing care to gender nonconforming patients at the Autism Center. So that's in our larger kind of treatment branch, where they're doing more kind of biobehavioral intervention or doing mental health treatment or through other assessments or medical consultation and med management. So there's a really large growing portion of individuals that are gender nonconforming that are being seen at the Autism Center and providing care there. So here's some of the evaluation specifics that we'll talk about a little bit. But essentially, evaluations, they're typically scheduled for multiple appointments. And that is just really so we can get a really comprehensive look at children and their families. Up through 5 years of age, it's generally about 2 appointments. I would say the vast majority of people we're seeing are 6 or older. And at 6 or older, we think about 3 appointments generally. Sometimes it's more, but generally 3 is kind of that minimum. And a lot of our assessment relies heavily on interviews with both the parent and the child together, and with each of them alone, if that's doable. And it really depends on the family. For some families, parents really want to be there, or a child really wants their parent to be there. And for other families, we want to make sure that we're also spending that time getting each person's unique perspective. So this interview is really getting a sense of a wide variety of different aspects of development, of current mental health concerns, of gender identity, really to get that clear picture. So typically, there are times where a child is kind of being referred directly to start cross-gender hormones. That's often rare that's kind of the immediate step, but we would kind of, unless a child is be directly referred, we really want to see families back for additional follow-up. So if they're immediately going back to gender clinic on main campus and starting their medical interventions, we may or may not see them for follow-up, but I would say on the whole, we really like to see our families 6 months out after our assessment, just so that we can check in and see how things are going, see if we can help troubleshoot, access to treatment services, aspect to other things, how they're just navigating this process and what questions have come up. We also really rely heavily on supporting our understanding of our patients with any sort of collateral contact with their ongoing community treatment providers, which can provide a great opportunity to get their take, as well as to provide options and kind of support and psychoeducation too for providers that might be wondering how to proceed. And then we also think about collaborative care with the gender clinic at main campus and providers there, since often that is our referral source. And so there's really direct communication and collaboration there to make sure that we're serving families both medically as well as thinking about this mental health component and thinking about factors related to autism. So in general, our clinic flow it starts with an initial referral, and from either the Autism Center or from the psychiatry department. And our first assessment day is really where we get really in-depth interview, assessment. We do gender identity questionnaires, often kind of paper and pencil. But again, because we know that individuals on the autism spectrum can have really diverse communication needs, diverse intellectual abilities, we adjust things. We provide assessments in a way that fits with a child's communication style as best we can. Questionnaires regarding mental health concerns, parent questionnaires are completed, as well as self-report questionnaires if that is feasible for the patient. And then our second day assessment is where we do some of the more hands-on testing, which can be cognitive testing, can be executive functioning testing. So again, that we mentioned that highlight that kind of increased prevalence of ADHD. So often we're assessing for executive functioning because what we find is that this inattentive ADHD type, it's been very interesting, has tended to kind of been missed. And so we have teens that are showing up 16, 17 that have never been diagnosed with ADHD and have potentially struggled with these executive functioning challenges for a long time, but haven't, they've kind of flown under the radar. But now, especially once high school hits, things really kind of accelerate and it becomes difficult to manage in that way. So executive functioning measures are something that we're looking at. And then if there's a question of autism, we would do the gold standard autism measure, which is the Autism Diagnostic Observation Schedule, or the ADOS, to inform that question of autism, as well as get an in-depth early developmental history. And what's not pictured here, but we have then a follow-up feedback session where we're providing results to the family, providing recommendations for treatment, and for potential directions, next steps, as well as scheduling a time to follow up with the family. So thinking about our assessment model and our clinic that's growing in capacity and is exciting to see, we want to think that for families that kind of to provide some guiding steps in terms of if this feels like a clinic that might be a good fit for your child, for your family, that we can kind of give you some guidance of next steps. So a referral to the Autism Center Gender Clinic would be most appropriate if you have a child that has diagnosis of autism and has questions around gender, or has expressed potential gender diversity, or is wondering about that. Potentially, this is something you've already sought out within the community, but at the Autism Center, we can provide that kind of intersection of care. Also, a great fit for a referral would be that if you have a child who's gender diverse and has demonstrated social communication impairments and behaviors that might be suggestive of autism. Maybe that's been a question in the back of your mind, or it's something that's come up more recently as something that could be the case. This would be an appropriate referral for our clinic. Additionally, we also see patients that have established autism and gender dysphoria diagnoses, and they're coming for support for treatment considerations as well. And so we really like to see families along their pathway. I mean, it could be at the very start of this pathway, or it can be farther down the road. And we want to support families and really partner with families in a way that's meaningful and holistic for them. In addition to the assessment services that we provide, we also provide these mental health treatments. So here's where we think about individual therapy, and then something we're very excited about, but we have an upcoming social skills group for individuals that are gender diverse. So looking at individuals around the spectrum, teens particularly, and how to navigate social skills aspects that are unique within the context of also being gender diverse. So that's something we're really excited to get started up. All right, and lastly, I just want to note some of the community resources that are available. This is just a handful, but these are some of the services that we find have been just a really great fit for families, and that we often are directing families to. So there's a series of different community support groups that are really ASD inclusive and have provided really wonderful support for both children and youth and their parents as well. So Youth Eastside Services has a group called Be Glad that does really wonderful work and provides some great therapy services for youth that are gender diverse and also on the autism spectrum. The Ingersoll Gender Center provides wonderful care as well, family support, navigation, advocacy, all these different components. Thriving on Two Spectrums is a really exciting group that actually provides both parent support and teens, children and youth support. And it's in a collaboration with the ARC of King County and provides really targeted support and a space for individuals that do fall on both spectrums. So it's really got this kind of unique aspect and provides this also parent support component that's very cool. And that is also in collaboration with Gender Odyssey, who also does really fabulous things to help support families and support individuals that are gender diverse. I also included Seattle Children's Gender Clinic at Main Campus, their website and phone number, as they have some wonderful resources as well within their clinic, and in terms of just guiding next steps for families and great handouts and supports in that regard. And of course, they're also actively serving patients in the community. All right, so those are kind of the handful of resources. I would note that we're happy to chat more about other resources and provide additional supports. This is just kind of the select couple, but we're of course happy to provide more. All right, I'm going to wrap up. And thank you all for listening, and we'd love to take some questions. Yeah.
My name is Jack. I'm actually a queer autistic. Thank you. And so I just wanted to put out one more additional resource. This is geared more for adults, but there is the Square Pegs meetup group. They have an LGBTQ support group. Like I said, it's primarily like older teens or adults. I currently run that group. I'm also a volunteer on the Thriving on Two Spectrums. And for the last 2 years, I've been working with therapists on that intersection of gender and autism because right now I'm getting my master's in education, and from taking classes in the psych department, I'm not super thrilled with how a lot of textbooks handle both subject matters. And so if I'm happy to work, I'm happy to like talk to a class, I'm happy to work one-on-one or with a small group. You can find me either through Thriving on Two Spectrums or the Square Pegs meetup group. But like I said, if you want a more like, as a queer autistic who grew up in the 90s before there was really an awareness of this, I'm happy to provide that sort of lived experience along with this more up-to-date research, because I find that sometimes it can be good to get that lived experience alongside the more clinical aspects. So I just wanted to put those, additional resources out there.
Thank you. Yeah.
Well, like I said, if you can find me either on Thriving on Two Spectrums or the Square Pegs meetup, and then from there you can email me. Because like on Meetup, you can contact me, and then, yeah. So just find the LGBTQ Square Pegs support group. Oh, I'm Jack.
Thank you very much. Yeah, that's great. Excellent.
All right, so we have a question from a neurogender diverse kid who is watching online with their parent. And their question is, if gender is a social construct, why is gender diversity a disorder?
Gender diversity isn't a disorder.
Oh, sorry, the microphone.
Thank you.
That's a really good question and a good thing to clarify. So gender diversity and gender identity aren't a disorder. And in fact, even having it near the DSM is kind of a challenge, because the conception is that the disorder isn't gender diversity. The challenge is having dysphoria or distress about it. And our goal as mental health providers and as medical providers is really to ameliorate that distress. So the disorder is that dysphoria and depression and the things that come along with it.
Hi, I noticed in one of the slides it talked about assessment goals, and it's actually talking about gender dysphoria. I work with gender diversity, and we see a lot of families who come in, and some of them actually don't have dysphoria. So I wonder if you could define what you're meaning by your gender dysphoria diagnosis.
Yes, I'm glad you bring that up. I think that I would say that has been our experience as well. That we have patients come in that aren't expressing gender dysphoria. As part of, I think the slide you're referring to has the different kind of list of various guidelines, and within that, I think it's important to acknowledge that each of those doesn't need to be met in terms of moving forward. So we're looking to understand gender dysphoria, and we're looking to think about dysphoria in terms of how it informs then movement forward into thinking about intervention and treatment to help ameliorate that distress between assigned and affirmed gender. But that's been our experience as well, is that some individuals are not presenting with dysphoria. Or also, I think something that I wrestle with a lot is thinking about that assessment of dysphoria as well. And I think with this population that's on the spectrum, I think that individuals on the spectrum are also going to experience identity in a different way as well. Everyone experiences identity differently. So I think gender dysphoria in that kind of that clinical definition is something that often is limiting in terms of how we think of exactly what that looks like. And that's going to look differently for different people. So I think that while, I think in that discussion of understanding dysphoria, we want to really be thinking about not being limited by the confines of what we're trying to understand about dysphoria, and try to think about, for this unique individual, is there distress? Is there distress around this incongruency? And does that look potentially different depending on someone being neurodivergent or having a different perspective? Yeah, yeah.
I think a good way that I think about it.
Do you want to come back?
Oops, sorry.
Yeah.
I think another way that I think about it, instead of distress, I think about dissonance. So kids with autism will come in and say, like, some kids are so blunt. They'll say, I just don't want this penis anymore. Do you know, they're not necessarily distressed about that body part, but they don't want it anymore. Do you know, and I think one thing that we've really learned with kids with autism especially is that they really have trouble articulating that unless they're really blunt and really concrete. And we find that if we ask them to do paper and pencil tasks, we get the information where they need, where to give that gender dysphoria diagnosis, where they're saying, I really don't like this body part, right? And I really don't want it, and I want it to change because I want it to be more like my affirmed gender. And I think that's the way that I think of it more, not that you have to be dysphoric, I'm sorry to be dramatic about it, but that it's dissonant for you. Does that make sense? Okay.
Up here in the north. I work in the Seattle Public Schools, and I work with kids on the spectrum, and I'm not understanding communication from that culture super well. So I'm curious how an autistic, what behaviors are communicating I am in dissonance.
Oh, I see what your question is, I think. So you're asking what behaviors would we see from kids that are suggesting that they're feeling that they're not their biological gender? Is that what you're asking? Whew, I think I unpacked that okay. I think unless a kiddo tells you, or really, I think it's hard to judge. If you're asking for a child who's nonverbal, we've recently had some experience with that, and I think that it can be more concrete in terms of how they want to dress, for example, and being persistent or being very distressed, like you'll see behavioral dysregulation around gender-specific clothing or activities or even the pronouns you use. So what we'll see is more of behavioral dysregulation, and just like you would for seeing most kids with ASD who can't really communicate their emotions, behave in uncomfortable situations, which would include a lot of behavioral dysregulation. It's a little bit more challenging to parse. Sometimes it's also more straightforward to parse. So it's very interesting, but I would let behavior show a change in behavior that sort of surrounds gender-related activities is usually the key.
So you mentioned having a nonverbal autistic going through this process. Where is the level, I guess, of how significantly their autism impacts them? Where is that line, I guess? Is there a line? Does that make sense? Yes, okay.
Yeah, no, that's, yeah, I think that's an interesting question. You know, I think that, and I'd be curious, maybe we can both respond to this, but I think that something that that we're becoming increasingly aware of and seeing more individuals that are coming for these gender assessments is that that level of impairment in terms of autism and whether that be cognitive impairment or behavioral difficulties can cloud the picture and often lead to under assessment and underdiagnosis of gender dysphoria or of gender questions, and kind of and often in cases kind of a disregard of those gender, or a kind of qualifying it under this but they're impaired in these variety of ways. And so something that we're really trying to make sure that our assessment is inclusive and is really understanding, so that level of impairment in autism is not, we're trying to consider holistically, right, versus level of impairment within autism and how that would influence gender. I think that we want to really consider those two things, how they intersect, but also try to weigh them in and of their own right, as well as unique aspects of an individual. And thinking about some of the patients that we've seen that are nonverbal and but that are giving clear signs that there is this dissonance in their assigned gender and their affirmed gender, and helping families navigate that, and also helping educate providers and support that process, because it has often been kind of discounted or discredited in that way. So I don't know if you have more you want to add on that, but I think it's an interesting question and a constant thing that we're wrestling with to try to make sure that we're really providing holistic care.
I agree. Yeah, it's actually kind of a poignant question in a way, in just serving people with autism, because I think people with autism have struggled for a long time, especially people who are nonverbal, not having us, neurotypical people, perceive their behaviors as just autism. And so I think we feel really strongly that we have to take a deeper dive when those kids come to us, to look beyond the surface of what autism looks like. And for us, I think that our last one of the kids we've recently seen was really instructive for us, because we went ahead and we did cognitive testing, and we really got to see that the child had a lot more there than their presentation would show. So there's a lot in autism where we can miss that mark, because we as a culture are so reliant on verbal communication. We're also reliant on our own social communication and the way we use it. And so I think it's really important to step out of that box, irrespective of what you're looking at for a child with autism. But when it comes to gender, you really need to as well.
We get to?
Yes.
Sure, as long as there are.
All right. I'm challenged by students with ADHD also. Could you say anything about that world?
And kind of the interplay of ADHD and autism and gender diversity, or more ADHD as a...
Both of those would be great. Anything you can help. Yeah. I need help serving my kids with ADHD, and if gender identification is part of their person, I need to know more about that.
Well, that's a big question.
It's a big question, yeah.
Well, we still have a minute.
That's true, right? All right, we can dive deep.
I think a lot of what we would think of for autism would relate to ADHD too, because ADHD is also a pretty heterogeneous. ADHD is as variable as autism is. So I don't think there's a specific answer to that, other than it should be driven by the function of what you're seeing. And I think that probably should be your guiding parameters around what we know about kids with ADHD, being more impulsive and inattentive, right? And needing more structure. But I think that the important thing is really, again, to see them as individuals and really think about functionally where you're seeing the breakdowns in behavior. I think we have a Facebook question. Do we? We do.
Okay, so this is a question from Katrina online, and she is wondering, when do children age out? So especially about Seattle Children's Autism Center and Seattle Children's Gender Clinic at the Autism Center. So they have a 17-year-old trans daughter with autism, but they were only given a diagnosis a year ago. So they feel really behind, and they are also in SQUIM. So just thinking about for them, how does Katrina really set her daughter up for success?
I would, so just to give you the age ranges, we see kids, especially kids who are transgender, up to age 21, and so does the gender clinic here. So our age ranges is wider, and she sounds like a good kiddo for us to see in the clinic. So the best way to go about that is actually to have their PCP make the referral to us. So, because we'll see outside referrals as well, and then we can coordinate care with the gender clinic. Okay.
So one more kind of follow-up question on that, and this is really kind of just from looking at the website. So on Seattle Children's website, especially at the Autism Centers section, there's nothing about this. So what type of, how do we really guide that, especially with referring PCPs or parents, just to ensure that they are able to find and access the resources?
That's very timely because next week I speak with the person who is going to change the gender website. So the gender clinic website will now include our providers and as well how you obtain that service. We have a very collaborative relationship with the gender clinic. It's a really tight relationship, which has been really awesome for us. And in fact, their social worker knows so much about autism. She's a great resource. And I think because of that, we're going to be will be included specifically on that webpage, so that will be awesome. Okay.
And then thank you guys for that. Katrina wrote back, and she really appreciates you guys taking the time. So thank you.
Not a problem. You're welcome. Any other questions? All righty. Well, thanks, folks, for coming today. And please email us.